And we've got quite a large number of people that have registered and joined us today. And I see that the list is continuing by the second. So without further ado, let's start. Ladies and gentlemen, it's with great pleasure that I welcome you to the third edition of DOSCOTalks. I'm delighted that we have Professor Rakesh Sinha here with us, who is the medical director for the South Warwickshire NHS Foundation Trust, running 3 hospitals, from what I understand. He's had a tremendously illustrious career, and he has been a frontline warrior in the fight against COVID. As a matter of fact, Rakesh has also had the Pfizer vaccine. So we've got he's got first-hand knowledge of the vaccine, and today's talk promises to be extremely interesting and topical now that the vaccine rollout across India has begun. And I don't need to introduce our very talented moderator, who is also the executive committee member of the Old Boys Society, Yash Gandhi. Yash, thank you very much for joining us as well. And without further ado, let me pass it over to you, Yash. Hopefully you have many questions all set for Rakesh. To all the attendees, I would encourage you to type in your questions. Yash will be able to read them and ask them at the relevant points during this conversation, which should last an hour. So welcome everybody, and thank you for being with us today.
Thank you, President, Vice President, EC members. I'm very happy to see Mr. Kamal Ahuja from Doon School has joined us. I'll just do the more formal part, which is to just, in a minute, just read out the introduction to our esteemed speaker. Professor Rakesh Sinha completed his medical education in India, followed by postgraduate training at University Hospitals of Leicester in UK, specializing in intestinal and interventional radiology. In 2005, he was appointed as a consultant, having led cancer services and diagnostic services at South Warwickshire NHS Foundation Trust. He was awarded the Kemp Harper Prize by the Royal College of Radiology for his research in 2006 and appointed as a professor in 2014. His work has been extensively published. Currently, Professor Sinha is Medical Director for Emergency Services, and he is at the forefront of COVID management where he is. But of course, first and foremost, above everything else, he is a DOSCO, and it is a matter of great pride for us that we have somebody who's at the forefront of helping others fight Corona, and himself also has his experiences to share. Just 2 other things, which I don't know if Professor Rakesh Sinha wants us, but he's always been very passionate about getting people on beds outside the house or in the hospital, as what one of the pictures shared by his batchmate and our vice president is to go by. He is also, I'm told, an art collector, sir, and he's also very passionate about music, and these are 2 skills which Doon School also does encourage and take very seriously. So thank you very much, everyone. And I think I do see we have a good number of attendees, and I think let's first and foremost begin. I would begin by telling the attendees that please keep pasting your questions on the group, paste it to me privately, and let's first have as many people to ask Professor Sinha about his experiences, his views. To get the conversation rolling, I think I will ask the first question to Professor Sinha, which is that Professor Sinha, exactly a year ago, we were still getting news of some virus in China which had just made its way to Beijing. As I did see a CNN tweet saying that a virus from Wuhan has made its way to Beijing. This is exactly this time last year. And here we are, combating arguably something which we have never seen in our life and which we perhaps will not see in our life. So in 1 year, of course, everyone knows what has changed, but it is first things first, some very basic things first. I mean, a vaccine in 1 year, for a lot of people, there is a lot of skepticism about it, that, you know, people don't know the medium-term impact of it. People don't know the long-term impact of it. So a vaccine in 1 year, is this haste or is this scientific achievement? Are we taking extra risks. So can you just please tell me something about that before we move on to the nature and nuances of vaccines and all of that, sir?
Thank you very much. And it's a privilege to speak to my DOSCO fraternity. And thank you for organizing this meeting. So actually today is bang on 1 year exactly. So 20th January last year, the Chinese authorities, they released the genome of the virus. And when exactly 1 year ago, Oxford got the genome and they decided which part of the genome to use to make a vaccine. And what you're talking about is haste. I don't think it's a haste because we have used these kinds of vaccines before. We have used vaccines recently in the Ebola outbreak, which is the RNA vaccine. It has been a bit quicker than other vaccines because both, let's talk about the Pfizer or the Oxford AstraZeneca, which is known as Covishield in India. They are using the genome of the virus, and they're using that DNA or RNA to produce the vaccine. In case of Pfizer, they are using not the virus itself, but that protein kind of code, that sequence, which makes the spike protein, which is harmless. And because they are not really using the virus to make the vaccine, to make the virus vaccine, you have to deactivate the virus, make it weaker, grow it in either mammal cells or chicken egg. And then what you do is then you start manufacturing the vaccine. Whereas when you are just using a kind of just a short sequence synthetic genome, it is faster to manufacture. It doesn't take much time. You can scale up the vaccine production. So one of the reasons is for the quick turnaround is that they are just using a sequence of the DNA or the RNA to make the vaccine rather than waiting for virus and virus products to make it. Secondly, the technology was there in the sense that we were using it for Ebola virus and other viruses or Zika virus. So the technology was there. And thirdly, all governments around the world, whether it's UK, USA, India, they put a lot of money into production and research of the vaccine. All these vaccines have gone through exactly the same rigorous protocols, phase trials 1, 2, 3, and they have gone through exactly the same kind of publication. In fact, this was the first time that the trial protocols were openly published. Trial protocols, because of blinding and bias, are never published before the results. But this time, all the trials were actually published in BMJ and anyone could have a look at it, how the trial is running. It was completely transparent. So it was quick. And in America, the whole process was called warp speed, the whole process of vaccine production. So it was quick, but the protocols used and all the kind of parameters used went through the same kind of rigorous standards as in a normal vaccine production. So it wouldn't be right to say that these vaccines were hastily made. They have gone through exactly the same kind of processes as any other vaccine.
So thank you. Okay, so I mean that's very assuring to know. I think coming straight from the horse's mouth that there is no we did run against time, but we ran against time keeping in mind all possible precautions, taking all possible care. So just for the audience, I think you did touch upon it, but could you touch upon in very simple language the difference in the various forms of the various vaccines which we have available in every part of the world? Because the Pfizer is different from the Moderna, which is different from the one in India, which is different from the one in Russia. So something in brief about what our scientists have done differently in what place, without obviously, getting into the more specific.
So, simply speaking, generally what's known as conventional viruses, they use a virus that has been killed or weakened so that it can't replicate or reproduce. Mm-hmm. And that is kind of injected into the body, human body. Mm. So when the body gets the virus, all the kind of immunity cells, that what we know as white blood cells, T cells or B cells, they recognize that foreign element in the body. They kill it. There are some killer T cells, they kill it, but in doing so, there are other cells known as B cells, which produce antibodies to this foreign protein. Once that happens, then your body has this antibody to fight that infection next time you get infected. And there are also B cells known as memory cells who store that memory. So next time you are infected, they can rapidly start producing the antibodies. So that is a conventional vaccine where you have to inject a virus or a bacteria into the body. Now, because these vaccines are different, whether it's AstraZeneca, known as Covishield, or Oxford here, or Pfizer or Moderna, which are RNA vaccines, they are slightly different. So the virus that you inject into your body is known as an antigen. So the antigen, when it goes into the body, produces the antibodies and the reaction. Now, the Pfizer vaccine and the Oxford vaccines, they don't use an antigen. They use what's known as the genetic profile of the spike protein. The coronavirus has got spikes on its body. It uses the spikes to attach to the respiratory mucosa or the blood vessels. And so the Pfizer vaccine and the Oxford vaccine, they are slightly different. The Pfizer vaccine uses the messenger RNA. It goes into the body, so you're not injecting a virus into the body. You're just injecting that protein. And obviously the technical, difficulties of that is it's very fragile. How do you keep it and safe while you inject it to the body? You can only store it at -70. And the technology of it is it's kind of encased in a nanoparticle made of lipid. So that's a trade secret, how they do it. But once it goes into the body, your own body picks that up and makes the spike protein. And once the spike protein is made, that RNA is killed off. And then the body forms the antibodies to that spike protein. So it is slightly different. So in this case, you are actually sending a message to the body itself to make the spike protein. Whereas in the older vaccine, you send the virus itself. And briefly, the Oxford, what we are using in India, the Covishield, is also the DNA of the spike protein, but that is put in a common cold virus. They use the shell of the common cold virus, which is not infective in humans. They inject it, and then it produces the same kind of result. But because it is kept in a shell of that virus, it is more robust. We can store it at room temperature, and you can inject the Covishield. As far as I know, the other vaccine, co-vaccine, I think, I'm not sure, but that is like a normal conventional virus where they're using the dead virus or weakened virus to produce the reaction or antibodies in the body. So those are the kind of viruses we are using at the minute. Okay.
Of course, there are a lot of, the type of vaccine and all has a lot of questions. When you took the vaccine, we would love to know, did you have a choice about which vaccine to take, and why did you take the vaccine which you took? Yes.
So yeah, so one of our hospitals was the first one to get it. There was a 92-year-old lady, Margaret Keenan, who got the Pfizer vaccine first. Now, we didn't have a choice, or no one has a choice. Now, there is a lot of confusion regarding which vaccine to take. Now, recently we had a test match. I hope you saw that, Australia, India. So I'll give you a cricket analogy. So what you're seeing in the publications, media, people talking about is what's known as efficacy of the vaccine. So Pfizer says there is 90%, Oxford says there is 70%. Someone says there's 50%. So to give you a cricket analogy, there are two things you have to consider. One is like a Ranji Trophy first class match. One is like a test match, So in medicine, we use efficacy, and there is something known as effectiveness. Efficacy is like a Ranji Trophy match. You test it in a, controlled environment. You only give injections to X amount of people in trials. You don't give it to elderly. So you are very, very controlled in that trial. But now that you know there is a batsman in first class cricket who's playing very well and he's got 50 average, let's take him to the test match. Now, whether he will do well in a test match is a different issue. And that is where effectiveness comes in. We know that they might do well because they have done well previously, but we don't know until we test it in the whole population, because effectiveness means you are giving this vaccine to all kinds of people, different demographics, different disease burden, elderly, immunocompromised, then that is really what the crux of the matter is. Like today only, there's a report come out from the Israeli spokesman that the Pfizer vaccine, they say that their efficacy is 90% after the first dose. This is the one I took. But they have given it to 200,000 or 2 lakh elderly individuals there. And after the first dose, they have found the effectiveness is only 33%. So there's a marked difference, So I don't think we should be caught in the results of the trial as such. All vaccines have been tested. They have passed, the first class, test that they are good. They can provide you protection. And we should be able to take any vaccine that is available to us. I took the Pfizer because I was offered that. There was no other choice. But I have to say, anecdotally, I have found that people who are taking the Oxford AstraZeneca or the Covishield, they are reporting more symptoms than the Pfizer, like pain or fever or body ache. It's much more common, and it's commoner in younger people because they are kind of mounting a more robust immune response. So that's the only difference.
Okay, I think now the questions are pouring in very fast. I want to ask, DOSCOs don't mince words, be it with themselves or when not with them, with the others. So Mr. Sanjeev Advani has asked the elephant in the room, or I would say the dragon in the room. He's saying, hi, Dr. Sinha, how safe is a Sinopharma vaccine? Yash,
it's very difficult to answer those questions.
Yes.
Because, like I said, the effectiveness of a vaccine will only be known simply because of the adverse effects, side effects. They will only be known once we have a longer term data of the population being vaccinated. Having said that, the Sinopharm just about made the grade. Its efficacy was about 50.6% or 50.5%. So above 50% is allowed. So obviously the effectiveness, I believe, I might be wrong, will be much less than that. Whether it's safe or not, I don't think they have released data about that. So I can't really comment on that.
Okay. This is one question which I have got from at least 2 people. And this is a very, very important question, considering we are discussing a very serious topic like vaccination. And once you answer that question, I will also take the names of the people who asked the question. And the question is, please ask Dr. Sinha, can I drink alcohol after getting a COVID vaccine?
Absolutely. Carry on.
So
no question about that.
So this question has been asked.
In fact, a lot of people have asked me on WhatsApp as well. I said, please carry on. as long as you don't go to a pub, that's fine.
I think the DOSCO is very, very relieved to hear that. And I may say one of the persons who asked that question is none other than our president, who himself has a very fine collection of wines, if his Instagram be believed. Yes, thank you. So now I'll come to the, Mr. John Mukhopadhyay has a question, which again is a very common question, and which is a very worrying question for many people, which is that the effectiveness of the vaccine against the various newer variants. Because even in the newer variants, there are various types of variants. And so what would you like to...
So what is lucky for us in a way is the vaccines have been made against the spike protein. And that protein molecule is quite a large protein molecule. So whichever viruses are being made, Pfizer, Oxford, or whatever, they act against that spike protein. Now, we have had some mutations. So to give you an example, we had the UK strain in the southwest of England. And what we have found is that virus or strain more infective? Is it more deadly than the other virus? What we have found is it's not all of that. All it does is it replicates more rapidly. So if a person gets infected with that strain, and there was one in Liverpool as well, that person produces a lot of the virus. So that person can infect a lot more people or give a very high virus load to someone who's infected. In fact, now in our hospitals, just this week, 50% of all patients who are positive have got the virus from the hospital itself. Nosocomial infections. So coming back to your point, so hospitals have become a dangerous place because it is spreading here rapidly.
Yes.
So the spike protein is a large protein, and the vaccines work against all that sequence of the spike protein. So for a vaccine not to work against that virus, the virus will have to go a very major mutation when the whole spike protein is changed. You know, only some sequences, small sequences of the spike protein have changed in the virus, which means the vaccine will still recognize that antigen. The vaccine will still act against that spike protein. Yes, in the future, if you have a new virus or if there's a major mutation, then the vaccines might not work. But that is not a concern at the minute.
Okay. So that's it's very assuring to hear. Mr. Sanjay Kapoor, also a respected board member in the school, he's posted a question. He's asked, there are the reports that around 23 or 28 people have died in Norway after taking the Pfizer vaccine. Now, is this true? Question one. And I will add to that question, how do you see that? Is this related to the vaccine, or it could just be that they had other...
So yes, it is true that 23 people have died, but even the Norwegian authorities have not clarified whether they have died from the vaccine. In fact, they have said they had other undergoing or they had other conditions. That's all they have said, because they are still investigating. But what is reassuring is they have not stopped the vaccination, which means that they think this is not because of the vaccine itself, but other causes. We haven't had any serious kind of issues here in the UK as yet related to the virus. There were two very early cases where they had an anaphylactic reaction to the virus. And that is, they were known to be anaphylactic, those two patients. And they should not have gone for the vaccination, So that was a mistake on our part. So that is basically a contraindication to vaccination if you are allergic to some of the constituents in the vaccine. But up to now, I don't think there is any, hard facts or evidence that the vaccine has, killed 23 people in Norway.
Okay. Before I go on to many more vaccine-related questions, which are very technical, I want to shift the discussion to another different topic, which is about you. I mean, again, as we've all discussed and as we've all known, this was a very, very unknown variable. It was a googly of sorts which came to us last year. How did you personally, what was going on in your mind when you were to come face to face with an unknown enemy? And as you've said, hospitals are ironically hotspots to catch that infection. So of course, your family, because many of us here, all of us here, we're very careful when we tell our own parents, when you want to go, if you stay home, or we ourselves take those precautions. So beyond the medical and the scientific explanation, what played out in your mind, especially in the initial phases, and even the decision to take a vaccine? We would really like to know that before we again move on to some more questions related to the vaccine, for which you will have many more technical answers. Yes.
So if I tackle your second question, why to take the vaccine first, or why did I take the vaccine?
Yeah.
There are several very important, reasons. Number one, to keep yourself safe. That's first, because if I'm a medical worker, frontline worker, I have to keep myself safe and not infect some other people, my family or patients, Secondly, you have to keep your family safe. So you owe it to them to have the vaccine. You might have multi-generational families living together, grandparents, grandchildren. So you need to keep them safe. I am also very aware of our historical heritage. We as Indians were pioneers in vaccine technology. In old texts, you find, cowpox vaccinations in India or China. You also have to remember in 1898 or 1899, when Haffkine produced a vaccine for cholera and no one believed him. So he went to India in what's known as Bombay that time. There is a Haffkine Institute there. And he became very famous for cholera and, plague vaccines. And that heritage continues, We are the biggest makers of vaccines in the world now. So we have our heritage of science as well. We've always, had vaccines, whatever, all of us, polio, DPT, MMR. We have been pioneers in India for vaccination. And generally for the economy of your country, for travel, all those issues. So, and you have to vote with science. We always had vaccines. That's how we eradicated smallpox or polio or whatever. So we have to step forward for the community and take the vaccine. That's a no-brainer for me.
Okay.
For all those issues. As far as how did I tackle it? I think about it. I was made in charge of, the emergency services. And I said, I think now, what the hell did I do that time? Because within 3 months, this pandemic came and all the kind of departments kind of under my portfolio, like respiratory, cardiology, acute medicine, ER, are all the ones that have been hardest hit in this pandemic, really. Initially, we didn't think much of it for the first week. We thought it's just another virus, like flu or something like that. People were even reluctant to wear masks or gloves when seeing patients. So they said, oh, it's nothing, But very soon we realized, let's say, for example, logistically speaking, if a patient comes to ER with coronavirus and a nurse sees him, the doctor sees him, the junior doctor sees him, straight away you've wiped out an entire department because then they have to quarantine for 14 days, isn't it? Because all of them are contacts. So a lot of things had to change very rapidly and we had to manage a lot of things. A lot of things became automated. A lot of things, you started using AI, a lot of things that were in back burner, IT for meetings, So a lot of changes happened straight away. And we have basically changed our way of working, doctors. And we are trying here, at least in the UK, to keep as many patients away from hospitals, treat them at their home, treat them in their community hospitals or in the care homes. And so there have been a lot of changes. And it's basically been, through this last year or so, working through all these changes, changing shifts so that doctors are not exposed for a long time to patients, shorten their interaction with patients as long as you can. So all those things have had to be done in an organizational way. And that has been the challenge.
Okay, that's something which is very important. I have two very similar questions. One is from Mr. Pramod Luthra, and the other is from Mr. Sanjay Kapoor. So the questions are broadly. I'll just read out the first one, which is Pramod Luthra's question, which is your thoughts on the 3 to 4 weeks time between the first and second dose, which the government has moved to 12 weeks, and the Israeli study says that the efficacy diminishes after 14 days. So what is your view on that? And Sanjay Kapoor has a very similar question, which is, what is the optimal wait time between shot 1 and 2? So, broadly, I mean, going beyond the purview of their questions, the whole issue of the gap between the first and the second shot, and does getting your first shot mean you're safe, or you have to wait till the second shot, or you have to wait after the second shot? So if you can give that whole picture, I think that would be very appreciable for you.
The reason we are getting 2 shots is because the trials that were used, Moderna, Pfizer, Oxford, whatever it was, they used that protocol. And their results are based on that 2-shot protocol. So the first kind of shot primes the body, and the second shot allows the body to mature the immune response and create adequate amount of antibodies and cells to fight the infection. Now, in the Oxford or Covishield trial, there was a mistake. I don't know whether you are aware of that. By mistake, they gave some patients half the dose. Okay. And then what they found that if you give some patients half the dose and then the second dose, their immune response was much stronger. Although this has not been kind of widely rolled out, but it's all to do with your body's immune response. Okay. And the trials have shown that if you take those 2 jabs within that set period, then only do you get the full effectiveness of the vaccine. So you have some protection when you take the first dose, but like you said, the Israeli study has shown that after first dose, but this was in elderly people. You need to keep that in mind. And in elderly people, the immune response might not be as robust as younger people. Yes. Okay. So in that Israeli kind of study, they have given this first dose and they have said that the effectiveness after first dose was only 33, but they haven't said what happens after the second dose. So we are waiting for that. Okay. What basically it means is even after you've taken the first dose or second dose, you still have to be careful. What you might not get is severe disease, which leads to hospital administration or some serious outcome. Okay. But it does not mean that you might not still get an asymptomatic infection. You might still get that. You might not feel anything. Okay. But if you have some other people living in your house, elderly people, you might infect them. So until we get widespread rollout of the vaccine, what's known as herd immunity or whatever we call it, we have to still be careful. That's my answer. And to get the full protection of the vaccine, whichever vaccine you're taking, according to the trial protocol, you have to take both the vaccines. Now, the time limits are 4 weeks, 3 weeks, 4 weeks. In the UK, they have delayed it to 12 weeks. In my own personal view, that is not good, but that is because of logistic reasons, rather than the supply of vaccines, rather than any good medical evidence. But what the government is doing by delaying it to 12 weeks is they want to immunize a larger number of the individuals in the population, rather than giving some people 2 shots.
I think that answers Mr. Anuj Bail's question. He's also asked the same question. That's a very valid point which you've made. He's also asked that question.
Yeah, so the UK government has decided to vaccinate more people first, rather than give some people the second shot.
Yes. So you spoke about elders in the family, which of course everybody knows is a point of special care. What about the vaccine and younger children, sir?
So
those who've joined us here are also parents of children or are soon going to be parents or what is
the issue? There are 2 issues there. One, most of the trials did not test it in children. So we don't know. So the UK has decided that below 18 years, we won't give them the vaccine. Okay. The trials also did not assess, coming on to that, to people who are going to have children, they have not assessed it in pregnant women. So pregnant women or women who are breastfeeding are not getting the vaccine. Okay. For the time being, because we don't have data yet of the use in pregnant women or young children. Having said that, Pfizer and AstraZeneca had some patients, but very small numbers, between 5 and 12 years of age and 12 years of age. So, again, it becomes slightly depends on the country itself and the demographics. For example, you often hear about something known as the R number. The R number is the number of infections an infected person can give. So if R is 1, that one person can infect one person. So we know basically that this virus, COVID virus, has an R factor of 3. So, which means by rough calculation, to produce, herd immunity, we need to immunize around 70% at least of the population, which is a large number. And if you look at, India, for example, if you take 70% of the population, that will mean immunizing, according to demographics, everyone from the age of 14 onwards. So below 18. If you take UK, which has a much older population, you have to immunize anyone over 25 years, everyone over 25 years of age to get that 70% figure for herd immunity. So it's different among different countries, but that's what we need to do over time. So what we are basically looking at sooner or later next year is almost universal immunization like other diseases. And like you said, the Israeli preliminary work has shown that the kind of antibodies or immunity kind of tails off after 3-4 months. So what we are looking at maybe is a vaccination every year, like the flu virus.
Yes. So of course, now we again to go to more specific questions. Kabir Vasudev has put a question, which is, can you have the vaccine if you're allergic to penicillin, or you are on blood thinners, or you have high blood pressure? Again, this is a question which is, at least in India, a very common question which people have. So what Kabir has asked is a very relevant question, and I hope you can answer that.
I think it's very relevant. If you have any comorbidities, you have to take the vaccine. Even if you are immunocompromised, you are on steroids, something, you should take the vaccine. The only kind of contraindications as such at the minute, either in the UK or from the CDC in the US, is that if you are allergic to one of the constituents in the vaccine, and most often is polyethyl glycol, which is an emulsifier known as PEG, PEG. So if you're allergic to that, very few people are, you should not take the vaccine. If you are highly allergic to a lot of things or anaphylaxis, you shouldn't take it. If you are pregnant or breastfeeding, it's your choice, you should not take it. But if you are a frontline worker and you're pregnant, so I'll go back to the Oxford trial. In fact, one of our colleagues who took part in the trial, she did not know whether she had the placebo or the vaccine. And she became pregnant, and we used to pull her leg all the time. I mean, she couldn't, not become pregnant for the trial, couldn't you wait? But there were about 30 females who became pregnant during the trial, but they didn't have any adverse effects. But that's a very small subset. But so right now, if you are a frontline worker, if you're a doctor, even if you're pregnant, you should discuss taking the vaccine, because having COVID during pregnancy is much worse than having COVID when you're not pregnant in a young patient, because you get to miscarriages, preterm birth, lots of complications if you're pregnant and if you get COVID. So if you are exposed and your work is such that you're exposed to, high risk environment in hospitals or whatever, nursing, then even if you're pregnant or breastfeeding, you should consider taking the vaccine. But those are the contraindications, that's it. Everything else is not a contraindication. You should be taking the vaccine.
Okay, a lot of questions. One of the attendees, Uday Pratap Singh, he's a journalist, and he's asked again a very pointed question, like a journalist would ask, which is, will India see another peak of cases, and when? And there's another, just to add to that, there are people who also asked you about why cases are now again increasing in the UK and US. So would you like to club these questions and answer those together, please?
I think first of all, I would say that you guys and everyone in India, everyone there, parents, they are lucky not to have a second wave. Okay. Right now in the second wave, the number of patients we got is easily twice the number in March last year. Nearly twice. Now, why is it happening? And also, we actually have a golden opportunity at the minute, because here in the UK or in the US, we are already in the second wave. We are already suffering. At least in India, the second wave has not happened, but you've got the vaccine. So if you take the vaccine, you might not have the second wave. So that's a golden opportunity for us in India, whereas we already have had the second wave. Why is it happening? It's difficult to say. When the coronavirus kind of pandemic started in March, I don't know whether you remember, there were 2 outbreaks. One was in a meat processing factory up north of England. There was another in a sausage factory in Germany. A lot of people got infected. And people realized that these factories were wet, they were cold, air conditioned, People were standing close together on the assembly lines. They were shouting at each other because they can't hear because of machinery noise. And people realized that it's basically droplet transmission. That's how it's spreading. And the virus likes places which are wet, which are cold, people close together. And in UK or USA, particularly in cold countries, you have to realize that all houses, shopping areas, shops, restaurants are all, double sealed. They don't have ventilation because of central heating. So the virus the droplets tend to stay in the air for a long time, So the rate of transmission is much higher. Whereas in India, even if it's winter, you have sun. You have the ultraviolet, which kills off or evaporates the droplets. You have ventilation. You have a much younger population. Here you have much higher rate of obesity in US and in UK as well. So there are a lot of demographic changes, age-related things, the atmosphere, the climate. We can't say what exactly is the cause, but there are a lot of hypotheses going around that these could be the reason why there are much more higher incidence of spread of second wave in US or in UK.
Mm-hmm. Do you think the mRNA vaccines change the DNA of a person?
No, that's a misconception. That's which is going around. Let me go back a little to how it started. For example, let me give you an example. There was an epidemiologist in Germany who writes a lot of blogs against vaccines. He's against any vaccine, even polio, DPT, MRI. He's against all of that, and he claimed, for example, that this vaccine, it can make you infertile. You can't have children. That's one of the things. Another thing was it interferes with your DNA. That is because he said that the vaccine has got a syncytin genome, which is the same as the placenta. So it will attack the placenta. You can't have babies, which is absolutely nonsense, but it went viral. It is like Yash, me saying, my phone number has got the number 6 on it. Your phone number has got the number 6 on it. So if you call me, you'll call your number as well. That's ridiculous. It's just one small kind of fragment in the whole placenta, but these things become viral, unscientific. Similarly, people say it interferes with your DNA. No, it doesn't, because it is a messenger RNA. It does not go to your DNA or does not attach to your DNA. It just produces a protein, the spike protein, which your endoplasmic reticulum does. It has nothing to do with your genetic code as such. And it is engineered in such a way that it cannot attach to any gene. So all those are kind of unscientific, viral things that are going around, but they don't have any scientific basis as such.
Okay. Another very, it is a question which people who are not who are not as aware about the situation. I also have that question, which is that, do you take the vaccine if you have high antibody levels?
Antibodies to what? To corona, to COVID?
Yes, to COVID.
I think what they are saying is you shouldn't have it within 3 months of your infection. That's the guideline here in the UK. They might be different in USA or in India. Guidelines here are, if you had the kind of infection, you should actually take the vaccine after 3 months. Okay. Because if you had if you had antibodies, there are two things to consider. One, you might have been really unwell. You might have gone to hospital. You might have been really sick. You will have the antibodies. Okay. You might have had a very minor infection. You didn't even know about it, but you still have the antibiotics. So it doesn't mean that your body has matured or has got enough, antibodies to fight a subsequent infection. So yes, you have to wait, but you should take the vaccine after 3 months.
You should still. Okay, one question, which is again, Mr. John Mukhopadhyay asked, and I think you may tell us, is it fact or fiction? Low mortality in some of the developing countries. How do you see that? Is it about statistics? Is there a fact? Is there, how do you view this?
I think there is a fact that there is a low mortality in India, no doubt about it, compared to, say, UK or USA. There's no doubt about it. You see, again, I'll go back. A lot of the deaths that have occurred are in a different kind of demographic almost. Whereas, elderly people, older people, you generally have younger subset in India who are mainly asymptomatic or don't have severe disease. Like as we went through this pandemic, what we realized is it is not just a lung disease. Now we are setting up, clinics for long COVID, and we will see the effects for a long time. Lung damage, and we are already seeing that for people who are on oxygen because they had COVID 1 year ago. They have still not recovered. But what we have realized very soon is, apart from attacking the lungs, and why it was causing so many different kind of symptoms, this virus, is it also attacks what's known as the endothelium, which is the lining of the blood vessels. That is why you have symptoms like someone has, chest infection or chest symptoms. Someone has, GIT symptoms like, diarrhea or, something like that. Someone has body pain, because if you can imagine, it's attacking the blood vessels, then you can go anywhere, any organ of your body, and a lot of deaths that are happening in the older age group is because of what we know as thrombosis. So they get blood clots in the lungs, they get strokes, blood clots in the brain. And this is all kind of related to, this virus. So there are a lot of things that we still have to learn why it affects some kind of demographics more than the others. But we still don't know the answer why some countries have, low mortality. It has to be a host of many different factors.
And there's no word out yet on getting vaccinated every year or every 2 years as yet, right? I mean, I think this vaccination is for life.
At the minute, I would say, seeing the effectiveness and the antibodies, it will probably be every year, very soon. Or there are, more developments happening where they will have a nasal spray vaccine, or they will have a patch where the RNA vaccine, that molecule on the lipid molecule, that can be put on a patch, like you have a nicotine patch for anti-smoking, or and that can just absorb in the skin and go in. So you may have a patch every year. So other things are happening, but I don't think this is going to be for life.
Okay, you're still not sure about that. I see.
So I'm not sure. What I'm not sure about is whether it'll be every year, every second year, but it will have to be repeated.
Okay. Abhishek Bajoria has a question, sir, which I think most of the younger DOSCOs, especially the unmarried ones, would be very keen to know, is that when can you start proper exercising after getting COVID and recovering from COVID?
I don't think there's any guidelines for that. As long as you're feeling well, you're feeling fit, I don't think there is any kind of indication why you can't exercise. I know that there are cases with long COVID where you have a lot of weakness, for months or weeks, or malaise, or not feeling well. But I don't think there is any contraindication to exercising or just walking or running. I don't think there are any contraindications at all.
So you can, but I mean, you do have to give your body some rest even after COVID, don't you? I mean,
yes, you have to recover. You have to recover. You have to recover. And as long as you're feeling, even if you're not doing strenuous exercise, even if you can go for a walk, that's fine.
No, but yes. So basically that's a call you have to take yourself.
Exactly. Yeah. There are no contraindications that you should not exercise. Yeah.
Okay. And Mr. Bharat Swarup wants to ask you, is that do asymptomatic patients need a vaccination? That's what he has.
Yes, we all need vaccination because, like I said, we have to build up the herd immunity for everyone, for the whole community, for the whole country. So we really need to be responsible and take the vaccine. If you are in that age group, maybe if you're not below 18, fine, you're not giving the vaccine, that's okay. But if you are fall within the kind of government guided, stipulation, over 70, over 80, over 60, over 50, whatever, whenever your turn comes, you should be taking the vaccine. The reason I say is the only one constant feature I find in this disease, I might not know a lot about different things, but one constant feature I have found about this disease is that it's very random. we cannot predict who will have a bad outcome. I've seen yesterday a 25-year-old died in my hospital. No other comorbidities, 25-year-old. So I think it's a duty for us to protect ourselves. So even if you are asymptomatic, I think you should take the vaccine, because you might have a bad outcome if you get severe COVID.
You spoke of the herd immunity. Now, this herd immunity is, I think when you talk of herd immunity and when we hear of the word herd immunity in weddings in Delhi, it's very different. You talk about it very scientifically, but if you go to any wedding, I think the most conventional discussion in any herd immunity is come. I think we've got herd immunity. I think I've already got it. Now, tell me something. When you say herd immunity, are you talking of something which is desirable or something which is fait accompli? Because I think, as you've said, for 80% of a population to get a disease, I mean, it is not a small thing.
Yeah.
So when you refer to herd immunity, what do you mean? And is this your first choice?
So let's go to a different disease, which has a very, very high R number, 17 or 18. R number is 17 or 18, which is measles. Yeah.
Okay.
So for something such high R number, you have to have almost universal immunization for children. Obviously, there are some in America or wherever, there are some anti-vaxxers who don't take measles for whatever reason. And it is known that when they do get outbreaks of measles in that community, they do much worse. So you can't get herd immunity just by going to a wedding. That's one thing, okay? Because we are talking of large numbers. Yeah, and at the minute, if you think about it, the population of the world is about 6 billion. How many of them have got COVID? Hardly any. If you think about it that way, So here they're saying in the UK, 1 in 10. So that's 10% people have got antibodies. And we are talking about 70%. To actually, you have to understand the concept of herd immunity. Herd immunity is a concept which is loved by government policymakers, which is loved by epidemiologists, because you then protect a population, So to get that herd immunity for this disease, in fact, you will have to approximately 60 to 70% of people will need to be immunized. And you can't do that by going to a wedding. You will have to have something formal like vaccination, So
it's a very important message.
Yeah.
Thank you.
So you can't get that, because even now, maybe less than 10% of people in India are positive, or even less. And you're talking about 70% to get that level of herd immunity so that most people are safe.
Yes. So now, of course, now we don't have much time. So we'll now ask the final questions, more like the rapid fire, before which we can go back to you. There's another very interesting line of thought which people have wanted to know about, which is that, if you just take one of the vaccines and you still don't get immune, can you take another vaccine? Now, you see, this is, you may think that this is not a very important, or this may not be very scientific, but I think for lesser mortals who are not particularly so clued into these things. Now,
I think you should stick to the first vaccine, whatever you've taken. Don't mix the vaccine.
So
because the sequences, the genetic sequences are different, and your antibody production might be different, So the idea is, if you've taken the Pfizer, take the Pfizer. If you've taken the Covishield, take the Covishield, or whatever. Don't mix them.
So vaccine loyalty.
Yeah.
And
whatever's available.
One more question I had is that, these, they keep discussing vaccine nationalism, which there's much written and talked about. What about vaccine companies sort of demeaning each other? Because, from what we thought, when we were seeing the rates, one was saying 94, the other went to 95, the other. So it was basically like the Delhi University cutoff rates, from
exactly.
No one came lower than the other. And
yeah.
So
that is the, they have to promote their products, So that's company speak. Like I said, that is Ranji Trophy, Great, you've done well. But whether it'll work in the test match, we have to see, And as far as I'm concerned, they have all been passed. They have all got over 50% efficacy. So we have to take whatever's available to us. I don't think any vaccine is better than the other or worse than the other. For the vaccine, we've got data on. Yeah. I'm not sure about the data from the Chinese vaccines because we haven't got the data. Okay. But from what
can I also ask you about Sputnik then? Since you
Sputnik again, we don't have data. We know that is an inactivated virus that is being injected, but again, they have not released any figures, so we don't know. They claim that they have recruited a large number of people, but we don't know. So it would be wrong of me to speculate on that.
Okay, I think that's it from me, because we are now coming towards the end of the session, and I think, in my view, personally, I think it is very good, because there are not many DOSCOs in the field in which you're in, unfortunately. So, which is why I think it is very important that we need to showcase this to our community, that we have people like you who've taken something which many DOSCOs don't take for whatever reasons, and is doing something so inspiring, doing something so motivating, taking a risk. And I think what you're doing is helping humanity. It's not only your hospital, or it's not only you. What you're doing is very, very, very exemplary, sir. So personally, and on behalf of the DOSCO community, we are very, very proud and very, very happy. I would like to now pass on the proceedings to the President and the Vice President, and I would leave the floor to them. And thank you very much, sir, for patiently answering my questions from DOSCOs from various generations. I know some of the seniors have asked, some of the more junior have asked, and it just shows that there is, of course, a lot of curiosity on this topic. So over to the President and the Vice President, please. Thank you very much. That's it from me.
Thank you, Yash. Thank you very much.
You're muted, sir. You're President, you're muted. You may need to unmute yourself.
My apologies. Rakesh, what can I say? Thank you very much. It's been a most interesting talk. You've given us facts. You've answered lots of candid questions that we all have in our minds, and you've done this so beautifully in just the span of an hour. Thank you for taking time out. I know it's the middle of the work week, middle of the work day. It's very kind of you to join us, and I think we're all richer after this hour, learning so much more about the various vaccines. And I personally have to say that I'm a little more comforted by the knowledge that I have gained over the hour. So thank you very much for that. And I wish you all the very best. Please do stay safe as you battle on. Yash, thank you very much for a wonderful moderation. Knowles expected you to do a tremendous job, but thank you very much. You managed to capture so many questions in such a rapid fire manner, which was wonderful to watch. And we're going to arm twist you to come back again and play this wonderful role.
I'm more than happy to.
So, and before we depart, I'd like to invite the Vice President to say the closing remarks and a very important announcement as well.
And just before that, I think before this talk began, I think somebody wrote "No Tata be secret." So before the Vice President speaks, I want to put that very, very clear. Also, I was also Tata B. So there are 3 Tata B people on the screen you can see. So yeah, over to you, Vice President.
Thank you, Taran. Thank you, Yash, so much. Thank you, Rakesh, for taking time out from your busy schedule. Just a quick announcement, everyone. We have a survey. There'll be a window which will pop up. I do request you to take it, please, while I just kind of introduce Rakesh from the school days. So if you can have the survey up, Neha. Thank you, Rakesh. Really kind of you. I think what also, I think the number of questions and all which were here, we didn't have time to answer them, but maybe we can do a follow-up session maybe after 3 months or 4 months when the vaccination has, the drive is more far spread, the reach is more. Also, maybe the school would be interested in a one-to-one question. So maybe the president can ask the headmaster if he would like to contact him and, have some more detailed questions, because the school's opening and the boys and all are coming in. So that was a good session, Rakesh. Thank you so much.
Thank you.
I think it's been 40 years now. We know you since 1981. Rakesh was also my house captain in Tarabi. So it's been a fantastic long journey. And he's evolved over the years from what he was, I think, a boxer and a bit of an athletic guy in school to a fantastic DOSCO and a doctor. And I think he will have his name in the record books or in history because his hospital was the first one globally to have the vaccination drive being started, if I'm correct.
There was an interesting story because this is in Warwickshire, so it's known to us DOSCOs generally because birthplace of Shakespeare, one, and the Edgbaston Cricket Club. The guy who got the second dose of the vaccine, the first was a 94-year-old lady. The second guy who got it, his name was William Shakespeare. Can you believe it?
Okay.
He was chosen to be the second guy to get it.
That's a piece of so I think you will be down in history, and thank you so much, everyone. Thank you, Yash.
Thank you very much. See you very soon. Thank you.
Thank you.
Thank you.
Thank you again. Thank you.
Thank you, Tarun.
Thank you. Bye-bye.
Bye-bye.